Hello.
Hello, Danielle Goss, International Board Certified Lactation Consultant, and
Dr. Weaver, chiropractor, also IBCLC, short for what she just said. Now, a product that we often use in our office, it's called a Neotech. We've talked about it before. And we're going to talk about the Neotech and ties and how they can sometimes help. Tongue ties or oral ties. I'm going to talk about the 4 grades of a tie. So, grade 1 is a posterior submucosal, so the back is tethered. Grade 2 is also a posterior tie, so a baby cries and the tongue cups up. Hard to diagnose unless you really know what you're doing, but literally the tongue will cup and not elevate all the way.
which is why you need to have a functional assessment by someone who knows how to check. You can't just look and see.
Correct. Grade 3 is going to be more tethered, more to the tip. You're going to see it. And a grade 4 is all the way to the tip. It'll be heart-shaped. So with these babies that have ties, if the tongue is not undulating, meaning like a wave, when they can't suck, what they do to compensate is chomp. And obviously they don't have teeth, but they're biting.
Still feels like it's biting.
Yes.
Well, and they quiver. The jaw can quiver out of fatigue.
So with a baby who is tied, if they're on the nipple and they're biting, that causes pain for mom. A lot of times it will be painful before the feed, meaning before the letdown happens, and then after the letdown happens too, because if the milk is flowing, they have to swallow, so the tongue is gonna undulate a little bit more. So if you can give some flow, that can make a difference for baby, and they won't fatigue as much, which is where the
Neotech comes in. So to kind of explain, it is a cone-shaped nipple shield, but it has a little bit of a bridge feature, which is great because when you put it on, a lot of times with other SNSs or supplemental nursing systems, it's just the tube on the nipple, and it can be very difficult for parents to actually be able to do themselves. It's a lot of equipment, it's very overwhelming, and when you're sleep deprived, it just kind of goes out the door. It can leak, and the baby gets frustrated and smart and realizes it's a straw, which defeats the purpose.
And then it's fast for them because it's like a straw.
And then they don't learn.
And the Neotech is great because it's the flow is dependent on the provider or the parent, how much they're pushing. So it's not making a baby necessarily flow dependent. They are only sucking when you want them to.
It's a reward system.
Yeah, pretty much.
Yeah.
So when you put it on, we've demonstrated this before, but
you're going to invert
like a little sombrero or a hat.
Sombrero. So you can kind of see, make sure the bridge part is facing up.
So up meaning if this was your breast, it would be at 10 o'clock or 3 o'clock.
Yep. And so kind of going there, you push in and stretch it on. So it should look like that.
Your nipple should go in pretty far. It might not go all the way to the
It's
tip.
okay that there's a little bit of a gap because that's where the pooling happens. So if I'm a mom, I have this on.
First, fill this though. So with either express breast milk or formula, your choice, pull it up. So Neotech comes with 2 different sizes. This is a 20 ml, which is a little under an ounce, and then a 60 ml, which is 2 ounces. Fill it up, connect the tube, and then you're gonna latch the baby.
You have also 2 options. You can connect it closer,
which is a lot harder.
It's harder because you're really kind of getting in there and the baby grabs it. So it's a little bit more difficult. So this is a little easier from like clinician to patient.
But I think that this is easier to parent as well, personally.
Agreed.
Okay, so let's say the baby's latching, so you have the baby on. For the latch, we always recommend working with somebody who can teach you how to best latch. I wouldn't necessarily recommend going out and buying this yourself and trying to latch if you don't know what you're doing. Work with somebody. But when the baby's latched, they're on. With the tethering, what happens typically with the baby that is tied, mother can have a letdown response. So hormonally, after you have a baby, your milk is driven based on hormones, meaning baby latches, there's a letdown that occurs with oxytocin and prolactin, and the milk comes out and you'll hear suck, swallow, suck, swallow, suck, swallow, or you'll see suck and a swallow after. After the letdown happens, it's all biomechanics of the baby's mouth. Now, if the biomechanics of the baby's mouth is not working because they're tethered, it won't be the traditional suck, suck, swallow. It'll go suck, suck, suck,
Suck, suck, suck, suck, suck, suck, suck.
Swallow.
Best way we can explain it. It's like sucking a milkshake through a straw with a hole in it while running on a treadmill.
On an incline. Just
Very
really
difficult.
hard. Let's say they get the letdown and then they start to struggle. Then you could put the Neotech on, or you could do it before too, that's fine. There are holes in this, so if they get the letdown, they'll get it from the holes from mom's milk. And then you can start to slowly push. So you're pushing a little bit at a time. And the point is to push so it's like a suck, suck, swallow. So they're literally not burning. They're getting a little bit at a time.
And so if this is the lips, you guide with the chin up, right? So that this angles into the palate, because there's a pressure point in the palate that allows the baby to suck. So if this is angled up, now you can trigger that suck reflex and the baby can undulate a little bit better.
Which may or may not happen with the Tide baby.
Accurate.
So we're seeing if this works, if this helps, and the baby's able to be at the breast and associate milk with the breast, especially an older baby. Then they are not going to have a breast aversion.
It also helps protect mom's nipple, because Tide babies oftentimes can cause that lipstick creased nipple, which is not normal.
Or just pain, bleeding, fissures.
Yep.
All kinds of things with the biting. So at least hopefully they're not biting as much. They're not leaking. They're getting hopefully less air, and they're getting the supplement they need, and they're at the breast.